heard the concerns before, maybe even feel them yourself. People not taking the virus seriously. Some wearing their masks maybe around their chin or no mask at all. But those words came to us from men who have no way to escape those concerns. Some even worry they might die. News 3 Now investigates. Naomi Coles helps us look inside a Wisconsin prison that's seeing a surge in cases and growing concerns.
Several inmates have reached out from New Lisbon Correctional, where the pandemic infected hundreds earlier this month. One inmate was rather direct. "I was sentenced to time," he told me. "I wasn't sentenced to death."
Thank you.
Eugene Crisler had his daughters with him when we met outside the governor's mansion earlier this month.
I work as a part-time and full-time father.
At this sit-in,
They are in fear. They have family members that are calling.
he's standing up for those who aren't here.
You don't want to get sick inside an institution.
Crisler recently left New Lisbon Correctional. He served time there from February through September.
Social distancing wasn't enforced until probably a month prior to me actually being released.
Like the state, COVID-19 is spiking inside prisons. More than 8,000 out of the state's roughly 20,000 prisoners have been infected. 11 have died.
We are not isolated from a larger community. Our employees do not live in a vacuum. They and their families live in communities across the state where COVID-19 has been spreading extremely rapidly.
We compared Wisconsin's numbers to our neighbors. Minnesota has fewer than half the inmates, a bit more than 1/3 of our cases, and 4 deaths. Michigan, almost double our incarcerated population, does have far more deaths at 77, but we're quickly approaching their total case count. And New Lisbon has been the site of Wisconsin's 4th largest prison outbreak.
They contracted it from outside the institution and brought it in.
Inmates there and around the state echo a fear for their lives, neglect of basic needs, and policies they say have been implemented sloppily at best.
The only way you get help, and if it's truly a medical situation, you have to be dying. Very rarely want to send you out of the institution to a hospital.
In emails with 6 current inmates, one issue raised again and again are meal times.
Managing COVID-19 in congregate settings has proven to be difficult.
And isolation and quarantine concerns. "We stand in long lines to eat," one writes, describing how inmates get their food before returning to cells. Another, "We are still mingling with the positive people." And another, "Inmates that are not affected are forced to live with inmates who tested positive."
They either lock you down in your room and you're there with your roommate and you're both quarantined, or you are sent to segregation, which is also the hole, and you're there for 14 days. The nurse just comes in and she reads off your temperature. That's it.
With some saying they're being mixed with positive cases, a DOC administrator says it's because of how mass testing works.
Individuals that have been symptomatic have been isolated ahead of time prior to mass testing.
But when mass testing happens, many come back positive, but without symptoms.
So by the time we get the test results, which may be a few days later, those individuals have now been exposed for a long period of time.
And once those test results come back, entire units can end up in quarantine or isolation.
A lot of people, unfortunately, have been exposed in these settings, and by the time we become aware of a positive test, the other individual is more likely than not positive as well, and now could potentially expose others should we move that individual.
Mask wearing or not is another frequently cited complaint.
Some people were for the mask, some people weren't for the mask, whether it was people who were working for the institution or people who were inside the institution living.
If we find that an individual staff member is not wearing their mask according to our directives, they will be held accountable, and we go through a disciplinary process.
Issues like these are why local Madison-based prison advocates and the ACLU have been calling for the release of more prisoners, and why this sits-in outside the governor's mansion continues.
This is a human rights issue. These individuals were sentenced to time, not death.
Ultimately, Crisler said the staff have a hard job.
They're people too, they're human beings, they're overworked.
But feels if he doesn't stand up for inmates, no one will.
People don't get treated like human beings in there. They get treated like they're lost and forgotten.
DOC administration says they are moving forward on a couple protocols. They just introduced more frequent testing for staff last week, and they're also in the early stages of planning for vaccine distribution. In the studio for News 3 Investigates, I'm Naomi Coles.